Thank you. Liz.
Morning, thank you, Matthew. So to start off with, this is my first set of online teaching, so please do be gentle with me in the chat comments. If you do have questions, please pop them in. I will address a lot of them at the end, and I'll just get started. So it's really nice to see so many of you. I can see there's about 27 people, not including our own staff, so thank you. So my name's Elizabeth Telford. I'm a health and safety advisor specialist, and I have a varied background. I'm going to be talking to you today about health and safety and how far we should go with health and safety in this new COVID world. It's sort of unprecedented. We've heard that term bandied around quite a lot. And I think it's important to have a look, go back to legislation and have a look really at what we are obliged to do from a legal perspective. So first of all, how did I get here? So my experience, first of all, was on this lovely installation. This was my first installation up in the North Sea as a service engineer in drilling fluids. So I did a chemistry degree, and I was hot off the press straight up to Scotland from the south of England. And this is where I ended up for the first 9 months in my career. And then I carried on with other service companies and other rigs. I then used my time in Scotland to get outdoors a lot. This is me up at the Linn of Dee with a friend's dog. So I love the outdoors. I do a bit of climbing in my spare time. This was me in Tasmania. So I do love a bit of travel as well. I think it's important to get the personal perspective in before you get the professional. So this is what I do at the moment. So this is a lovely picture from one of the colleges I work at down in Cambridge, in the south of England. And this is a enormous scaffold project that we were working on at one of the colleges. So just to give you an idea of the scope of the projects that I'm working on at the moment. And this is the top of the King's College Chapel, which was where I'm very lucky to be able to pop up there as one of the safety advisors. So it gives you an idea of the sort of the scope of the work that I've been involved in, both as an engineer and also as a safety practitioner. I have a very kind of response in between as well. So in between my offshore time and my health and safety time in education, I worked at a pharmaceutical manufacturing site in Montrose in the northeast of Scotland. There I was heavily involved with major accident hazards, process safety and emergency response as a first responder, first aider. So I have a varied background and I have a varied breadth of interests. So it's nice to see so many of you. This is me, and I like to be called Liz, so nice to see you. So we're going to go through some of the aims that I would like to go through today as the course, because I know there may be some health and safety specialists, some managers in the group here, and there may be people who have not very much information about health and safety, or perhaps have a few questions about health and safety. The course at the moment is aimed at those who perhaps have not as much health and safety knowledge, and those who are managers. You might feel uncomfortable on your basis for bringing staff back into the workplace, or you might be unsure where to look at the health and safety from a legality and obligation perspective. So I'd like to kind of do a bit of myth busting or going back to basics with that, if you like. Perhaps you have been asked to go back to work and you're unsure or anxious really about how that's going to work for you. And there may be many changes of circumstances surrounding your job, surrounding the tasks you do. So I'd like to address a few of those. This is not intended to replace personal guidance you might have received that is specific to your industry and your role. Rather, it should complement the current legislative guidance, and it should offer you a starting point from which to continue forward. So I'm going to be going through employer compliance today with a specific look at the law, so the two bits of legislation, most importantly the Health and Safety at Work Act 1974 and the Management of Health and Safety at Work Regulations 1999. So these are the two bits of main legislation that I'll be going through. Then I'll look at legislation updates, so what has changed as a result of COVID, and we're only going to be looking at the main piece of legislation regarding reporting of injuries, diseases and dangerous occurrences at work, and that is RIDDOR. I'm then going to look a little bit at employee compliance. So you may not be a health and safety manager, and I'd like to address a few of the things that might be making people anxious at this time regarding their health and safety at work. And I'll finally go on to address the new normal. What does it look like? How does it feel? And how are we going to continue forward? Because I don't see it going back to the old normal that time has passed, and it would be nice to see what other people's perspectives are on that. So it would be good to have a look at those items there. I do have a takeaway from this webinar. So I've got a little snapshot here. This is a return to work checklist which I've created, and you can find that in the downloadable section of the website, the Inverroy website, which I'll put a link for at the end. This is just my thoughts on what would be prudent to look at as an employer before you bring your staff back to work. Sort of a tick off the list, have I done this, or have I thought about this before I bring my staff back? So that'll be there'll be a link for that at the end. So looking into employer compliance then, the Health and Safety at Work Act is the overarching legislation regarding health and safety at work in the UK. And wherever you may be coming from today, there may be sort of the overarching legislation that will cover health and safety at work. And they are very similar across the breadth of countries that I've studied, USA, Europe and Australia. The main term within the Health and Safety at Work Act that I want to pull back to is so far as is reasonably practicable. And this can be a bit jargon-like for those who haven't thought about it, but really what I want to think about here is it's a balancing act. As you can see on the screen, it's a balancing act between the time, the money and the practicability of making those changes for the purpose of health and safety versus the perceived improvement to safety for your staff and visitors. When we think about what does an employer need to do, it's really important that we always go back to what is reasonable and what is practicable under the Health and Safety at Work Act, and that's section 2. Ensuring staff safety, so far as is reasonably practicable, is all about a reasonable response. What would a reasonable person do in this position? If you took a snapshot of society, what would that group say was an acceptable course of action? Now, I know that not everyone has IOSH, NEBOSH, NCRQ, City and Guilds information, and those who have that may not remember what that means. So reasonable, would it be an acceptable course of action within your scope of work to take that course down the line? And practicable, are you able to? Do you have the funds, the resources, the time and this expertise to implement that change? So I'll talk a bit more about that a bit later on. The next piece of legislation I want to talk about is the Management of Health and Safety at Work Regulations 1999. This brings into the fore the idea of risk assessment. Now, a lot of people that I speak to in my particular field view risk assessment as paper pushing. It's just bad bureaucracy for them that hinders their work, that takes up their time, that isn't relevant for a lot of them, and they don't understand the process. Despite this fact, it is a legal obligation for all employers to do them. So I want to make risk assessment for my particular workplace good bureaucracy that works, that's collaborative, that's communicative, and that would be the best kind of risk assessment. Risk assessments under law must be suitable for the task, for the people involved, and they must be sufficient, so they must cover the entirety of the task. It must assess adequately the extent of the hazards, and in this new world, what new hazards are there? If you are a public-facing role, you've got the added hazard of suddenly having people who might be bringing an infectious disease into your workplace. So it must be really cover all the hazards. And if you have 5 or more employees, then you must document it. It's a legal obligation to write it down, keep a record of it, and review it in a timely manner. So if those of you who aren't aware of the risk assessment process, a basic guide to risk assessment is here. Now, many of you will have seen this before, so I'll just quickly go through that. So first of all, when we're thinking about a risk assessment, it's really important that we start at the very beginning, and that is identifying your hazards. The main thing about this I want to draw attention to is what has changed. COVID has changed this. COVID has changed the world we live in. So we need to, despite the fact that we have all this information already in all of our workplaces, we've got to go back to the beginning and redo it. And we have to redo it with COVID in mind. So when we're thinking about step 1, identifying your hazards, There might be hazards which have entirely changed or are obsolete entirely because that task you no longer do because of COVID. Different persons may be affected as a result of staff changes. You might have changed your workplace, equipment changes, PPE changes. Now, I know that if we work in the UK, so PPE is fairly easy to wear during the weather that we have, but if you're working in an environment where PPE significantly adds to discomfort of your staff, I'm thinking really sort of when I was in Dubai training, PPE was suffocating when you're working outside anytime from, you know, June all the way through to September, October. So it's really important to think about how changes are affecting your workplace. You also want to evaluate to show that your hazards, which were previously very low, to check that they are still very low. You might have a higher risk or a greater hazard as a result of COVID. You have to use your old assessments, so it's really important to keep those old assessments there, but the assessment that you make as a result of COVID should be a new and grounded one, grounded in the now. When you're looking at the next step, step 2, decide who might be harmed and how. It's really important that you take into account the knock-on effect of your staff going home. If your staff are public facing, they may be taking care of people at home who are not able to go out. And I know we've had some easing of the legislation in the UK recently, allowing people to see one other household. But it's important that when you are asking staff to come back to work, that you still consider who are relying on your staff at that particular point in time. Next, evaluate the risks, decide on your precautions or control measures. These must be, again, reasonable and practicable. They must be, if you asked a Snapshot of society, would it be acceptable to put this in place as a result of COVID? They must be reasonable and practicable. Finally, record your findings and implement them, very important, and then have your review and revise on your assessment and update it if necessary. The review and revise section of this is really important because every time the government guidance changes, your health and safety management must be on top of that and take into account any changes and put it into your procedure, your risk assessments. If you don't do that, you may be on the back foot when it comes to bringing staff back to work. They may have other friends who are employees elsewhere who are saying, well, we've got these control measures in place. And you say, oh, well actually, we haven't thought about that. So really keep on top of the up-to-date guidance from the government website, because that will give you a basis from which to control your staff base. The situation can change very quickly. It's really crucial in the risk assessment process that you always refer back to the most up-to-date guidance. So when it comes to legislation updates, the main bit of information that I want to talk about is RIDDOR. RIDDOR is the reporting of injuries, diseases and dangerous occurrences regulations in the UK. Without COVID, this required employers to report any injuries, diseases, dangerous occurrences to the HSE, the Health and Safety Executive, in order for them to determine whether it required investigation by their inspectors. As a result of COVID, you can now be prosecuted under the health and safety legislation if you expose your staff to COVID at work. So if there is, even if it's unintended, if you have an instance at work where someone has possibly or actually been exposed to coronavirus, you must report that to the Health and Safety Executive via their website. I want to really highlight here the possible or actual. There doesn't need to be a proven case of coronavirus, only the possibility of exposure. And I think this is really, really important to place sort of a highlight on here, if you like. It does not matter to the Health and Safety Executive if there has been an exposure, rather if you have allowed there to be a possible exposure because of your lack of control measures as an employer. So when you are looking at risk assessment, when you are looking at the controls you're implementing as a result of your risk assessment, think about this. If there is a possibility of exposure, that is still reportable. The next instance here then is if a worker has been diagnosed as having COVID and there is reasonable evidence it is caused by exposure at work. Now, reasonable evidence goes back to reasonably practicable. What would the snapshot of society say? What would the reasonable person say? Where's the evidence for that? So if there is a possibility and there is some evidence to show, or reasonable evidence to show it was caused at work, you can then be prosecuted by the health and safety executive. The final case here is if a worker dies as a result of occupational exposure, so exposure at work to coronavirus. This would come under the fatality section of RIDDOR legislation in the UK. So the first one, possible or actual exposure, is a dangerous occurrence. The second one, where you have been diagnosed as having COVID, that would be reportable under diseases. And the final one would be reportable under fatality. It is important to note that you can now be prosecuted both criminally and civilly in the courts in the UK for exposing employees to the risk of COVID-19 in the workplace. Not just the actual virus, but the risk of it in the workplace. It is important to really think about your insurance coverage if you are an employer, and also to cut it off before it starts and put the controls in place. So you might be thinking now, okay, so I've done my risk assessment, I've put in place some control measures, I've thought about what we can be prosecuted for, and I've effectively covered the company with my control measures. What do my employees need to do? And is this what our new workplaces are going to look like? Thinly spaced desks, one in front of the other, face masks on, nothing on the workspaces, etc. You might be thinking, okay, well, I'll go back to the legislation. The legislation says take care of yourself and others. Okay, we want to do some social distancing, obviously. We want to perhaps add in extra hand washing, or we're going to ask our staff to do more hand washing. We might then be asking for face masks in the workplace. Now, this has been controversial with some of the workplaces that I've been discussing with, and that will be based on your risk assessment and the risk to your staff in your workplace. But a lot of staff that I'm speaking to are really anxious, and they're not sure if this is enough. And it can be difficult to balance your staff anxiety versus the legislative obligations of your company. So I've been doing a little bit of research just for the background, and I've found quite a lot of new evidence now that shows that even being 2 meters away may not be enough to prevent breathing in the tiny droplets of water that carry the virus. And when you are then in confined spaces, so smaller areas with limited airflow, you get a buildup of droplets in the air just from talking and breathing. So you don't actually need to be coughing and sneezing on someone to spread the virus. Just speaking in an environment with them can increase the risk of infection. Now, obviously, if you're in a lovely new office, you've got great ventilation, maybe you've blasted all the windows open, that may reduce your risk quite significantly, and that may be enough for you to bring staff back into office spaces. But what about those areas and those workplaces that are perhaps a bit older fabrication, don't have ventilation or any kind of air conditioning systems, and perhaps a lot of offices perhaps don't even have windows? It's important to think about those areas and think what is the increased risk as a result of the lack of ventilation. So in those particular areas, it is the responsibility of the employee to take care of themselves and others, but it goes back to the risk assessment that the employer does, that the health and safety management team will be thinking about to really assess that risk and how high that is. It's important, obviously, that as an employee, you don't tamper with anything that's there for your safety, that if you're required to wear a face mask, that you do actually wear it. It's not going to put you in a good position if you're not abiding by those requirements of your employer. But I would say that communication between employee and employer is a really important relationship and building block for the changes that will happen as a result of COVID. You might be thinking as an employee or as an employer, a manager, my staff need to come back to work. How do my staff come back to work? I found this picture recently, and this really brought it home for me. I'm currently laid up at home with an ankle injury, so I'm unable to cycle, which is my usual method. And it's it's really frustrating because the only method I can't drive, it's my left ankle, so really I cannot do anything. It's really frustrating not being able to go anywhere other than using public transport or being driven by someone. So I really wanted to think about if I was someone who did predominantly use public transport, what would it look like? And this is what it looks like in a lot of buses and a lot of trains. And now EasyJet yesterday have, which is a UK flights company, have introduced, they're going to be socially distancing people on flights. So with a hugely reduced flight capacity. If this is what your journey to work looks like, I'm not sure about you, but it's very difficult to find a seat I can sit in. And what if someone sits in a seat that it says don't sit in this seat, which is quite a difficult one. I know in the London buses at the moment, they're really struggling with this, is people not abiding by social distancing rules. As someone who perhaps has anxiety, your staff may be thinking about coming to work and being faced with this and going, do you know what, I can't face this. This is too much for me. I don't feel taken care of. I feel like I'm at an increased risk because I'm required to come in on public transport. So thinking about that part of a work day and including it in your risk assessment is important. Now, from a legislative perspective, you are not required to risk assess with people coming to work. But if you require people to travel as part of their role, you must assess that part. And if you are wanting people to come back to work after a stint at home or after furlough perhaps, or maybe they've been working from home and now you require them to come back into work in an office area or a work environment, you must really think about, as an employer, how these people are getting to work, how your staff are getting to work. Because if they are faced with this, the work day is going to start with stress, the work day is going to start with anxiety. And if you can change that, if you can improve that start off for your staff, you'll be in a much better place in terms of productivity, efficiency, and the overall mental well-being of your staff base. It can be really confusing. For example, if you've got a cinema to run and the government's saying, don't use public transport if you can, and don't use these open areas of work. How am I supposed to get my staff in? If your staff base is predominantly minimum wage or low paid jobs, getting people to come to work are very often on public transport. So really consider the entirety of your staff base when you're looking at bringing staff back to work. So I want to talk a bit now about the new normal. And I know it may have been unfathomable weeks ago that this would be the new normal, that we would be working from home, that you're sitting in your home with the dog about to walk in and your partner or your children. It may have been unfathomable, but now we are looking at a large section of the working population in the UK who are able to and who may wish to work predominantly from home. What does this mean for workplace safety? Because workplace surely is at the workplace. How do we bring the workplace to home? How does the home become the workplace? And where do we sit legally as an employer? So my interpretation here is that the same rules apply with some leniencies or with some sort of stretching, as you like. So risk assessment and communication should always be the backbone of safety management. It's really important that when you are implementing changes, you communicate them to your staff base, and being collaborative about changes, asking opinions on risk assessments, and making sure that staff are happy and understand what changes are being implemented and why they are being implemented. COVID has raised the question, why? Why are we doing this? So many times in my workplace, and I think when you're looking into your workplace, why are we putting this in place? Is it because we're overreacting, or is it because it's based in risk assessment of the task that we're talking about? So think about those when you're looking at bringing sort of the work into the workplace at home. If the workplace for your staff is at home and they're required to work there and they've not been furloughed, have you given them suitable desk and office equipment to be able to complete their job safely? The HSC had some information regarding display screen equipment and temporary working from home. If now you are having more permanent working from home, what are we? We're nearly week 11 of lockdown for some, week sort of 8, 9 for others. If they've been working from home for a significant amount of time, a couple of months, and it is foreseeable they'll be working from home for another couple of months, you're going to need to think about a significant part of your year. And that is enough to build up an injury if you're working from a chair or a desk that's the wrong height, if you're working from just a mouse pad on a laptop without a mouse or a separate keyboard, if you've been stooping over, if you've been sitting in the wrong position, it may have aggravated injuries you already have or caused additional injuries which weren't there before. So think about that if you're really going to be asking your staff to work from home a bit more, or for the majority of their week going forward. You will need to provide them with any kind of display screen equipment. So that might be additional screens, that might be mouse pads, gel pads for wrist support, proper chairs. Chairs are expensive. It might need to be that you're budgeting within your company to either bring chairs to the staff from their office or to provide them with additional chairs at home. So think about those, the working from home arrangements that you provide for your staff. The company should initiate this. It shouldn't be up to staff to say, look, I need all this stuff. Now, obviously you can't buy everyone work office equipment. There needs to be a limit to how far do we go with the health and safety controls. And that is really going back to your assessments of the risk. I know I keep going back to risk assessment, but everything that you do within the workplace must be based on that fundamental bit of information. And this can be one big risk assessment for everyone or task-based ones depending on your staff base. So starting from the top, what you need to think about within your new normal is, first of all, your policy. What is your policy regarding health and safety in the new time of COVID? From your policy, your aims and objectives, you want to set out your procedure. And this includes standard operating procedures, management systems, how are you going to manage COVID, your risk assessments, all of that comes under your management system. And then beyond that, does business continuity come into this? What happens if there is a crisis at your workplace and the people you need are at home? Do you have a first response that are able to pick up and leave from home and come into the workplace? What controls are surrounding that? So I think it's really important, once you've done your risk assessment, you've done all the policy, you've done the procedure, to expand your horizons and look at what else is included within that now that we have this new normal. And it might be that the new normal doesn't last for very long, that suddenly within 18 months' time we have vaccines that cover a variety of different pandemics, but the new normal is definitely here. So I think it's really, really going to be at the forefront of every manager's mind here to look at, what does this mean for us? How does this apply to our company? And what is the new normal for us? How do we make sure it's as safe and as happy and supported as possible? So that's really what I wanted to talk about today. We've ended with the new normal. You can find a lot of information regarding our new normal at Inverroy on inverroy.com. And also, if you need to get in touch with me regarding anything I've talked about today, please do give me an email. That's my email address there. You'll also find my checklist, which I've created, which is just a sort of snapshot of my thoughts on coming back to work, having been a person who was furloughed and is working from home. So you'll find that on the Inverroy website as well under our downloadables. And thank you very much. I'll have a look and see if you've got any questions now.
Liz, thank you very much indeed for your presentation. And I've just got a couple of overviews, perhaps while anyone who's listening wishes to ask a question. I've got one from Eddie Walters already, which I will save for a second. And Eddie, I will ask Liz to answer so that you're able to get your head around it, Liz. It's about Rydor, Ridor.
Yes.
So I'll come back to that question in a second. But firstly, it just struck me that the killer question is the whole thing of so far as is reasonably practical. And
Yes.
your comment about a reasonable person on a reasonable day, given the conditions, what would they reasonably expect? Yes, it's open to interpretation. Of course it is, because that's the nature of the business. But it gives you a great start point. And the whole thing, even our company, the idea of working from home, how do you do a display screen equipment overnight for 200 people or 300 people, or whatever is in your company? Clearly ours is a bit smaller than that, is really challenging.
Yes.
But your point that actually you've got 2 or 3 months in now, if you still haven't done one, okay, it would be reasonably practical to have done something, even if it's an email and do it online, rather than what you may have considered in the past as sensible of someone visiting the house and doing a face-to-face check. The Riddle stuff we'll come back to in a second, but thank you, Craig, for your comments about what's happening in Saudi Arabia and businesses being closed there because they're not complying with the procedure. And I loved your comments about the importance of collaboration and communication between the employee and the employer. It's not you must comply. Well, perhaps it is, but if it is, you may get the answer that you don't want to hear, and you end up with a staff churn because people just say, fine, I cannot come back in those conditions because of the risk to my family, etc. So that ability to communicate it suddenly becomes really important. So thank you for that. We've got a couple of messages, so I will.
Yes, of course.
The opportunity to ask. So the question from Eddie was about the Riddle slide and the implication that a huge amount of reporting under Riddle that may be required, and then the interpretation of that and the importance of, let me get this right, we should only make a report if COVID-19 had to be attributed to occupational exposure or as a result of occupational exposure, and the difficulty of proving that that's where it's come from.
It's a huge grey area for employers, and it's really, I mean, and obviously the health and safety executive in the UK will probably have a barrage of these reports saying, well, it's possible that my staff were exposed because of XYZ, and it will be up to them to filter through everything and determine what is the most important for them. The health and safety executive in the UK will only prosecute criminally if it is within the public interest. And that's really important. So if it is not within the public interest, they will not prosecute the company. They will not impose fines. They will not be able to, because you have to prosecute in order to get the outcome. What they may do is put in place other things like enforcement notices, prohibition notices, and that will require the company to make changes which will be checked up on by the health and safety executive at a later date. So where does your obligation end? What is reasonable? It's difficult, but I think it's important to go back to, if you had done something earlier on, put a control measure in place, then you may not have been in this position. So think about what you could do and if you are able to do it. And that really is where you have to look at it from a health and safety perspective. Providing evidence for whether someone's been exposed at work is very difficult. You just have to go with what you have at the time, and it will be specific to every individual case.
In which case, Liz, thanks for that, and reassuring that 2 health and safety managers both agreeing that it's going to be really difficult, and quote, it depends. One final question from, sorry, I don't have your name, but it says LGK8 2017. How long should one plan for the new normal if the new normal doesn't last very long? For example, if the vaccine comes out or the virus mutates into something else, firms will want to plan but still be cost effective. Do you have any thoughts on that?
Yes. I think I'm working with the University of Cambridge at the moment, and the University of Cambridge has put in place its 3 projected outcomes. And one of those is that the new normal doesn't last very long, that we can get back to business as usual quite quickly, perhaps within the next term time. The other option for them is that the new normal extends for up to a year after. So the next academic year for the university will not be with students. And the third option is that the new normal is forever, and it is finitely the new normal. I think it's important to look at all the options. You've got to plan for what could happen in the hope that it's brought forward it closer so that you don't have to ultimately follow through on those plans. But you must do the planning. You must put in place your risk assessment, because you don't know. No one can know. You know, there are conspiracy theories abound, but we cannot know when this will finish and what will happen. So you must plan long term and think about your business strategy and your crisis strategy for when that happens.
Okay, no, thanks for that. And I think yesterday, those that were able to join us and listen to Stu's presentation about decision making and developing those courses of action, it sounds that's what Cambridge University is doing on
Yes.
You know, option 1, 2 and 3, and when do you move between them is that critical thing that depends on Stu's description of the OODA loop about orientate, observe, decide and act, and the wealth of
and
data.
it has to be cyclical.
Yep.
You know, it has plan, do, check, act. It has to keep on going.
Yep. So sorry, I should say, yep, the deeming cycle of plan, do, check, act, exactly the same. It's a cycle. So so the question there, sadly, Zarina, you can't do it once and then forget it, because it's changing all the time. And I think that came through there with Liz's presentation and her answer. So thank you. I think that's all the questions we've got, Liz. So thank you very much indeed for
You're very welcome.
your presentation this morning. A quick parish notice. Apparently I mentioned gift aid, I know I mentioned gift aid for later. We can't do gift aid through this system, so please ignore that comment. It's now 10:40 UK time. As we did yesterday, we'll take 5 minutes to enable everyone for a comfort break or to get the kettle on and recharge. And then at 10:45 UK time, we'll return with John talking us through some observations about emergency response for the second module of the day. But thank you very much, Liz. Really appreciated your experience and wisdom. And everybody, will see you in 5 minutes time.